Could your new weight loss medication be able to curb more than just your appetite? What if you are actually curbing the effects of different types of psychedelic substances? What might that mean for what you feel and what you experience, and what that might mean for the types of outcomes that you're potentially searching for out of your psychedelic journeys? That is the question that I'm going to explore with you today in this short video. I'm Dr. Ben Malcolm, psychopharmacology consultant, psychedelic educator, and founder of the website Spirit Pharmacist. Before we dive into answering this very important and new clinical question that's really come up as these medications have gained popularity over the last few years, I want you to go ahead and like this video as well as subscribe to my channel. That's going to help us to continue to grow our audience and continue to put together this incredibly valuable type of content that really gets to the heart and center of what you're curious about or wondering about when it comes to drug interactions between traditionally available medications and different types of psychedelic substances. Go ahead and do that now. Thanks so much for your support. Okay, so getting down to answering this question about whether weight loss medications might be curbing more than just your appetite, I really want to begin by focusing on what kinds of medications that I'm really talking about here. And so the ones that I'm specifically focusing in on are the new GLP-1 or incretin mimetic types of medications. And so these are truly blockbuster drugs. They came on the market quite a bit of time ago, but they're originally marketed for the indication of diabetes and blood sugar control. But it was found that through their appetite suppressant and appetite curbing and increased satiety mechanisms, that they are very effective medications for the purposes of weight loss and the reduction of cardiovascular risk factors or cardiovascular diseases that can come along with excessive weight. And so examples of some medications include semaglutide and its brand names like Ozempic, as well as things like tirzepatide and the brand names like Mounjaro. Some others include like Byetta, Wegovy. They're all under this umbrella of mostly GLP-1 or glucagon-like peptide 1 related medications, but truly there are some other gut peptides that they can mimic. And so incretin mimetic is more the umbrella term for the medications. And so I think that while not definitively proven, it is highly plausible that these types of medications as a class could really affect psychedelic experiences and trips, particularly ones that are given by mouth. Why is this? Well, we know that as a class effect and class side effect, these types of medications, the weight loss drugs, slow and delay gastric emptying. And it's also well known that they can slow and delay the absorption of other types of orally administered medications. And it turns out for the most part that if you're talking about different types of cholesterol drugs, antihypertensive or blood pressure medication regulating substances, it doesn't necessarily matter so much if that drug is absorbed over a period of 1 to 2 hours versus a period of say 2 to 6 hours. What truly matters is that it's absorbed into your bloodstream or system because it's able to essentially have its therapeutic effect there. But it could be a much bigger deal if the medications or drugs that you're interested in were relying on achieving a peak blood concentration in a certain period of time, and that blood concentration was then highly correlated or tightly associated with acute psychoactivity. And that really is the case, I think, for many different psychotropic agents, particularly ones that are administered on PRN or as needed types of basis or frequencies. But for the orally administered psychedelic substances, just psychedelic substances, period, we really are achieving a certain type of psychoactivity, and that's going to require absorption within a specific time frame. So drugs or medications that slow the digestion and slow the absorption of orally administered drugs or substances are very likely to have negative sorts of impacts on particularly acute acting psychoactives, and psychedelics really fit that bill overall. So there is no formal level of data or study around this particular drug interaction in question, but we know from several types of pharmacokinetic probe experiments with drugs or substances that have pretty predictable kinetics. We know them well. Things like acetaminophen, brand names Tylenol, paracetamol, Uh, this medication seems to, on average, have an absorption that's delayed by about 30 to 60 minutes, particularly when persons are just starting their weight loss medication or they're in a titration phase. And so, like all side effects, it's not necessarily, okay, if I'm taking this medication, there's a guarantee that there's going to be this significant delay in absorption. But it seems that on average, there really is this class effect that's likely to modulate the effects of acute acting psychoactives in variable sorts of ways, perhaps depending a bit upon the person and perhaps depending on which agent and sort of where in their therapeutic process they are with them. So I've had several different reports with orally administered psychedelics, things like psilocybin-containing mushrooms, MDMA, other even liquid psychedelics that are administered by mouth, ayahuasca, that the experiences really haven't began in their characteristic types of timeframes. And so all of these agents typically have effects that are noticeable within 30 to 45 minutes. And they typically have peak effects that occur within about 60 to 90 minutes after administration. And so some of the anecdotes that I've gotten, or some of the stories around this, have essentially said that the experiences don't show up from somewhere between 2 and 6 hours after administration. And they often show up in a relatively weak way that last for potentially longer periods of time than usual, particularly because the experiences tend to start so late. And this is really in line with what we know about the pharmacokinetic frameworks and the changes that these GLP-1 medications can really, elicit in other types of orally administered drugs or substances. So I guess what I'm saying here is I truly believe it, that I don't think that these anecdotes are just random or made up, because they really rationally fit with what we know about the GLP-1 related drugs or substances. Some other things about these GLP-1s, right, is they tend to have nausea and upset stomach as one of the most prominent side effect profiles. And nausea or upset stomachs can be acute side effects of psychedelics. So there's a potential for additive side effects with the GI tract beyond the sort of slowed and delayed gastric emptying. And then there's even some emerging information that suggests that the GLP-1 medications, beyond raising satiety, which tends to curb appetite, have anorectic or appetite-reducing sorts of effects, they might also be able to curb desire-related mechanisms. And while psychedelics are not traditionally thought of as highly addictive substances, highly rewarding types of substances, they oftentimes do have pleasurable effects, and some of them really do have habituating or rewarding types of effects, things like MDMA, things like ketamine. And so there could be multiple layers and levels of drug interaction to consider with weight loss medications or the blockbuster GLP-1 medications and different types of psychedelics. And particularly, again, psychedelics that are administered through oral or by mouth administration routes, I would have a whole lot less concern, particularly with the delays in absorption associated with slowed gastric emptying, if it was a psychedelic substance that was going to be administered through a different route. So for example, it's extremely common to see things like ketamine administered through intranasal, intravenous, intramuscular types of routes. Maybe even sublingual lozenges could bypass some of this delayed gastric emptying. Certain types of psychedelics, N-dimethyltryptamine, 5-methoxydimethyltryptamine, are most commonly administered through inhalation routes. And so these other non-oral routes of administration are very unlikely to be impacted by this type of drug interaction risk. So that could be one management strategy if we really didn't want to rock the boat as far as changing the GLP-1 medication, and really whether a person should consider changing it or make changes to it, what those changes could be, I think is a little bit more complex than simply, okay, there's a drug interaction, so I must avoid it by discontinuing something that might have really helped me and created a therapeutic benefit that was positive, maybe even for control of more serious conditions like diabetes. But there can be a lot of health benefits to weight loss. Reduction of cardiovascular risk could come along with that. And again, these GLP-1 medications are truly being studied at this moment in time for anti-inflammatory purposes, for substance use disorders, for other types of mental health benefits. So it just may not be our best practice or best form to think about just applying sort of blanket rules as well. There's some kind of theoretical drug interaction, so everybody needs to stop their medications. I have a webinar program that explores this in a whole lot more detail, going through a little bit more history of what this class of medications are, really combing through the clinical data that is available that demonstrates slowed gastric emptying, talking a little bit more about these, I would say, more speculative pharmacodynamic types of interactions that could be happening within the brain or the central nervous system rather than in the GI tract, and then walks us through several different case examples of, I would say, persons that are in different therapeutic positions with different therapeutic relationships where there are GLP-1 types of medications, and offers a little bit more as far as advice on how to manage this incredibly common and important clinical scenario. Again, if you got value out of this content, go ahead and like and subscribe to the channel. Do check out the webinar link below to the expanded program on GLP-1 medications and psychedelics. Until next time, stay safe and be well.